Hello, today we're going to talk about giving an IM injection to a newborn. We'll be administering vitamin K, which is to promote blood clotting in a newborn. Because they're born with a sterile gut, they're unable to produce vitamin K until after their first breast or bottle feeding. So one of the most important things to remember about giving an injection to a newborn is that, unlike an adult, you can say, Mr. Jones, I'm going to give you an injection, stay still. Our baby is not going to stay still. Every time we touch our baby, her arms are going to flail, legs are going to come up. So it's very important to stabilize the leg very clearly when you get ready to give the injection. We also want to check our physician orders first. We want to check the vitamin K vial to make sure we have the correct neonatal dose, which is 1 milligram, and we'll check the expiration date. Now, when we get ready to give our IM injection, we've identified our infant as well by identifying the armband, and we're ready to proceed with the injection. So we've got a 1 cc syringe with a 25 gauge needle. Some facilities will have a Brist ejector we put together. Others will require that you draw from an ampule and then use a filter straw to filter any glass particles from the medication. Today we're not going to actually inject into the baby. We're going to just focus more on holding the baby and the actual technique. So we're going to have 1 syringe and we have 2 alcohol preps. So we're going to get close to our baby. The side of the bed is down so we can really get close to our baby. Left leg is preferable to most facilities. However, you'll need to check with your individual facility as to whether it's going to be the left or the right leg. So again, our baby is moving around. It's not staying still like this. Foot is going to come all the way up, and I'm holding the leg underneath, so I'm taking and making this large muscle mass kind of very prominent so that I can see the spot. We're going to start off with 2 alcohol preps to help identify our site. We want to use the vastus lateralis, which is just lateral to the midline on the baby's thigh. We don't want to do midline because we have a danger of injecting into a blood vessel. So in order to identify your site, holding tightly to the back, to the baby's leg, we've got 1 alcohol prep, and we're going to do wet, wet, and wet. And if you look closely here, you see there's a demarcation between wet and dry. This dry area here is the area that we're going to use to give the injection. So with another alcohol prep, we're going to clean the site, uncap our needle, again holding close to our baby. We're going to go directly in at a 90-degree angle, inject, we're not going to aspirate, and then we're going to inject the medication. We're going to come straight out. We're going to cap our needle on the side of the bed so we're not going to stick ourselves, cap, and then we can use either the alcohol prep that we use to prep or a clean 4x4. So we're going to rub. Some facilities will actually place a Band-Aid at the site after the injection is completed. Some babies will cry a lot after this injection, some will not, so we can just shush and soothe our baby after the first injection. And that's it.